Okay, so now that we've had some time to go over your nutrition history and your current diet and your medical history, we're going to do what's called a nutrition-focused physical exam. A nutrition-focused physical exam is a hands-on assessment that's specific to the nutrition components of health. So what we're going to be doing is we're going to be looking at your hair, your eyes, your skin, your mouth, and we're also going to be looking at certain areas of the body to look for fat and muscle wasting. Do I have your permission to perform the exam?
Yes.
Okay, great. Okay, so I'm going to go ahead and put on my imaginary gloves. I've already washed my hands.
Okay.
So we're going to go ahead and do that, and we're going to start with your hair. So I'm just going to have, just going to take a look at your hair, and we're looking for any sort of bald spots, any sort of thinning. I'm also going to go ahead and just pull slightly to just see if hair easily falls out. Now I know we all lose hair in the shower, on our pillow, those types of things, but have you noticed any more hair loss than recent or more than usual?
No.
Okay, great. And some of the things that we can see in the hair, which is really interesting, is we can see if there's deficiencies in iron, zinc, essential fatty acids, as well as protein and biotin. So if those are compromised, we can sometimes see that in the hair, but your hair looks like it's normal. So we're going to go ahead and move on to the temples, which is something we can look at to assess for any fat loss.
Okay.
And I'm just going to have you look straight on, and it looks like that area is well defined for you, so it's not sunken in, which is something we might see in malnutrition. We're also going to go ahead and take a look inside the eye, and I'm just going to have you look at my imaginary flashlight.
Okay.
And just follow it along. And we're looking at the sclera, which is the white part of your eye, and I'm moving it sideways so that you aren't seeing the light directly.
Yes.
But we're looking at the sclera. We're looking for any inflammation, any any spots or things like that, and any dryness. Have you had any dryness in your eyes at all, more than normal?
No, not more than normal.
Because that can be a sign of dehydration, but that looks like it's good. Now, the only thing I'm going to have you do with your eyes is if you could just pull your eyelids down.
Both at the same time?
Yeah, sure, that'd be great. Okay, great, thank you. So what we looked at there was the color of the under eyelid. If it's pale, it could indicate anemia. So that's one of the things that we look at too. So
it looks good.
It looks good. Yeah. So the next thing we're going to do is we're going to go ahead and we're going to look at the lips and the mouth. So one of the things that we look at for the lips and mouth is if they're dry, swollen, or cracked. Have you had any issues with your lips or anything like that?
No.
Okay, and any sores or missing teeth or cracked teeth or anything going on in your mouth that you're concerned about?
No.
Okay, great. So one of the things that we can see on the lips for dry, cracking lips is B2, B6, niacin or iron deficiency in the lips. So that can tell us a lot, but it sounds like everything's looking good there. And we can also look to see for any dehydration. We're going to go ahead and take a look inside your mouth, if you don't mind.
Not at all.
And one of the things that we look at inside the mouth, I'm just going to have you stick your tongue out. Thank you. I'm just going to look on both sides. And like you said, no cracked or missing teeth, so we're good there. Thank you so much. One of the things that we look at there is if the tongue is inflamed or magenta in color, we can see B12, B6, niacin, or folate deficiency. So that's one of the things that we can look at there. And then the other thing that we can see as well is if the tongue is swollen or what they call a beefy tongue, that can be a niacin deficiency too. So those are some things that we can see inside the mouth. Okay. So everything looks very normal for you there.
This is good.
Okay, great. So now that we've looked inside the mouth, at the teeth, and the hair, we're going to go ahead and assess some specific areas of the body for fat loss and muscle wasting. So we're going to start with your clavicle, which is this area here. And it's going to be put on your shirt there. And in a well-nourished person, this area will be you won't be able to see the clavicle bone easily. It won't be easily protruding. But for women, a lot of times it does do that. And I see one side of your chest there sticks out. Is that something that has always been that way?
Yeah, well, recently. That's just arthritis.
Okay,
right
okay,
there.
great.
Yeah, only on one side.
Okay, yeah, I can see that. Okay, so no issues there. You've already met with your doctor on that. Okay, great.
Yeah, took an x-ray. Yeah.
Okay, thank you. And the other thing, I'm just going to have you pull down your sleeve here.
Okay.
And the other thing we look at is on the shoulders. We look at what's called the acromion process, and that's the junction between your shoulder and your neck and your shoulder and back. And you can go ahead and pull your shirt up.
Okay.
What we look for there is signs of muscle wasting there. That acromion process will be protruding in someone who isn't well nourished, unless that's just normal for them, and they can that is always present for them. So everything looks normal for you there. So next we're going to go ahead and we're going to move on to your back. So I'm going to have you, if you can, just press on my hand for me there, straight out. And we're just going to go ahead and feel the back of your scapula here. And we're just feeling, and we're feeling for protruding shoulder. And if we can kind of grab the shoulder and cup it almost, so that area is well defined, so that looks good there. And you can, actually you can just leave your arm out like this. And we're just going to feel your ribs too. And in a well-nourished individual, we should be able to pinch between our finger and thumb. There should be some fat present there, so it looks normal there for you as well. And then we're going to go ahead and just look at your tricep area, because this is an area too. You can kind of relax your hand there. This area is somewhere we also assess for fat loss. And there, in a well-nourished individual, we should be able to pinch some fat between our index and thumb.
You can do that. Can you tell if it's over too much fat too?
Yeah, you can. And people who are overnourished can also, people who are overweight can also be malnourished. So that's why we take a look at all of these signs so that we can assess that properly.
Sure.
So you can go ahead and put your arm down. And while I have your arm, we're going to go ahead and look at your skin. And I notice you have some freckles as well. And look at this side too. I notice you have some freckles too. So do you have any concerns about your skin? Any recent changes in your skin that you've noticed that you're worried about, any rashes or anything like that?
No. The only recent change was a spot on my cheek, which I went to a dermatologist to take care of.
Okay, great.
And these are just age spots, they say. Or sunspots, whatever. Yeah.
Okay, well what I'm going to do is I'm just going to take your hand, if you don't mind. I'm going to go ahead and pinch the top of your hand here. And what that tells us, and it went right back to normal very quickly, in someone who might be a little dehydrated, if we were to pinch that, it might stay that way. Yes, exactly. So that's looking good. Last but not least, actually it's not the last thing, but with your arm here, I'm going to go ahead and look at your nails. And we're going to look at the nails to see for different shape, color, if there's any markings on your nails. And your nails look very, there's no polish on them, which is great for this exam, but they also feel very smooth. One of the things that you might see in someone who is iron deficient or even protein deficient is spooning in their nails. So their nails will actually
divot?
They'll have a divot in them. The other thing that we see a lot of times, if you have longitudinal ridges in your nails, that might indicate iron or folic acid deficiency.
Now, once in a while that has showed up. And I have been iron, I've been given by my doctor iron supplements, yes. Okay. But if they look good now, then that means it's
so
good.
it cleared up after you were taking, are you taking any iron supplements now?
Not right now.
Okay. No. Okay, well, your nails are looking really good. A lot of people complain of like dry, brittle nails too. And that can indicate magnesium or selenium deficiency, especially if they're really flaky. The other thing that we look at, and I'm just going to do that for you here, is nails that blanch poorly, which means when we press, they turn white, but when we take our finger away, they get pink again. When it takes a long time for those capillaries to fill up again and turn pink, that can indicate a vitamin A or vitamin C deficiency. So that's some of the things we're looking at there. Now, last but not least, we're going to look at the lower half of your body. I'm going to have you stick your leg straight out for me. Thank you. And what we're doing is we're just feeling your thigh for any muscle loss here. You can go ahead and put your foot down. And in a well-nourished individual, the thighs and the calves, which we see here, are well-defined, and that's something we're looking for in a well-nourished individual. For someone who's malnourished, You might see some muscle loss there. The calves and thighs will not be well defined, and you can clearly see some diminished muscle there.
Yeah.
So the last thing we're going to check for is edema. So what I'm going to do is you can just leave your feet flat on the ground. I'm going to go ahead and just press down on your ankle, and I'm going to release, put some pressure on, and it looks like there was no indentation left. So with someone with edema or swelling, fluid accumulation in their lower half of their body, you'll see, you'll press down and that pit will stay there.
Okay.
So that's one of the things that we look for there. So that looked normal. Thank you so much for letting me